Hi everyone, welcome to NephMadness 2018. My name is Tim Yao and I'm a nephrologist at Washington University in St. Louis and the social media editor for the American Journal of Kidney Disease. This year I was also lucky enough to be one of the game makers for the activity. If you aren't aware of NephMadness, it is a free online educational event that highlights important nephrology topics. Like March Madness at this time of year, participants read the scouting reports, choose winners, create their brackets, and discuss on social media with the hashtag NephMadness. Head over to the AJKDblog.org to read up on this year's topics and submit your own bracket. We were lucky enough to sit down via video interview and hear some nephrology experts explain their choices for the champion topic of NephMadness 2018. First up, we have the battle of the journal editors. The chief editor of CJASN, Dr. Raj Mehrotra, versus the chief editor of AJKD, Dr. Harv Feldman. First up, Dr. Mehrotra is a professor of medicine and section chief of nephrology at Harborview Medical Center in Seattle, Washington. He did his nephrology fellowship at the University of Missouri and is a clinical researcher with a focus on various dialysis modalities. For NephMadness 2018, he chose Patient-Reported Outcomes as his champion.
The patients have been demanding our attention for a long time. And I think finally, through a variety of initiatives that are happening around the world, we nephrologists are finally hearing the voice of the patient. The SONG initiative that has come out in terms of asking patients what the clinical outcomes that are important to patients, as well as a lot of initiatives like No Decision About Me Without Me, which is extraordinarily important. I think we as nephrologists have been far too focused on the esoteric, and that stimulates our intellectual curiosity more than what is meaningful to the patients. And so that is why I think there's some of the clinical trials that I'm doing are focused with patient-reported outcomes as the primary outcome measure. And along with that, we have the patient voice editorial that we have started in CJASN. So all of that is that theme that's in my mind in putting patient at the center of what all we do is why I think the patient-reported outcomes is the most important one.
Next, we have Dr. Harv Feldman, the chief editor of AJKD. He is a professor of medicine at Penn, which is where he also did his nephrology fellowship. He is a clinical nephrologist and also the chair and director of their biostatistics department. His primary research focuses has been on the epidemiology of chronic kidney disease. For NephMadness 2018, he chose the Untransplantables as his champion.
We have a huge unrealized potential from transplant technologies that arise, because of challenges in identifying sufficient organ resources for our patients who otherwise are, of course, suffering through all of the consequences of end-stage disease. And so, I selected this because it's really our most restorative therapy, of course, transplantation. There are new opportunities now in terms of overcoming, APO incompatibility or HLA incompatibility. Some of the novel trial that many of us have seen on endopeptidase as a possible opportunity for us as well to more effectively address these kinds of incompatibility issues that keep very substantially live donation even from contributing as much as it could. So for me, this really represents an avenue for us to very substantially reduce burden of illness, reduce cost, and that's why I was drawn to it among many other really important topics in this year's bracket, but it eked out above others that I was also considering.
Next up, we have the battle of the presidents of the two major nephrology organizations in the United States, the National Kidney Foundation, or NKF, versus the American Society of Nephrology, ASN. First up, representing NKF leadership is Dr. Holly Kramer. Dr. Kramer is an associate professor at Loyola University in Chicago, Illinois. She completed her nephrology training at Harvard and also completed a Master's of Public Health. Her research interests include public health aspects of kidney disease, including nutrition, obesity, and cardiovascular disease. For NephMadness 2018, she chose the global impact of prematurity as her champion.
So I think kidney disease is an epidemic, and people just don't get that. And people realize that maybe cardiovascular disease is decreasing, and we're all shouting and thinking that we're really great. But at the same time, kidney disease incidence is going up. The number of dialysis units in Jamaica, a middle-income country, has actually doubled over the past 10 years. And the kidney disease in these low-income and middle-income countries, it's not sustainably treated with dialysis. We have to address the prevention of kidney disease. And even with our own country, as dialysis incidence, it continues to increase, the financial stability, it's not sustainable. We can't continue to just dialyze more and more people over time. It's just not something we can do. So after looking at all of the things in these brackets, I really thought that prematurity at a global level will have the biggest impact. There's 15 million babies that are born premature every year, and that is rising. It's the leading cause of death among children under the age of 5 globally. And currently, between 5 to 18% of all children are born premature around the world. So according to Barker's hypothesis, David Barker, who's a famous epidemiologist in the UK, he's related low birth weight or prematurity to the origins of multiple chronic diseases like hypertension, diabetes. He didn't specifically talk about kidney disease, but then later, Barry Brenner linked this prematurity, low nephron mass due to prematurity, linked that with chronic kidney disease. I think prematurity, even up itself, is probably not a huge issue as far as kidney disease lifelong. But if you combine that with the fact that we have a huge nutrition transition in all these middle income and lower income countries, the combination of those two is a disaster for kidney disease. In other words, it's like a tsunami of kidney disease that's coming towards us, where you still have very poor nutrition for mothers, so that you still have prematurity that's increasing, and you don't have a healthcare infrastructure in middle and low income countries to care for these small children that are born premature. Then they're put into a framework where they're surrounded by calorically dense, poor nutritious food, and so that by the time they're 35, they have a BMI of 30. If you look at diabetes incidence in the 1990s in middle income countries like Jamaica or Cameroon, it's really, really small. Maybe 1% of the total population would have diabetes. Whereas now the incidence of diabetes is triple, quadruple what it was maybe 15 years ago. So you combine that with kids that have a low nephron mass, combined with obesity, and then they also have low beta cell mass from prematurity, so they have a higher incidence of diabetes, they have hypertension, they're eating horribly. It's going to lead to a higher incidence of chronic kidney disease. So that's why I think prematurity, because of the fact that we're in this caloric transition, especially in middle and low income countries, it's a disaster, it's a tsunami for kidney disease incidence globally.
Last but not least, representing ASN leadership is Dr. Mark Okusa. Dr. Okusa is a professor of medicine and chief of the nephrology division at University of Virginia Health Systems. He completed his nephrology fellowship at Yale, and he has been an NIH-funded clinical investigator for 3 decades, with his work focusing on mechanisms of kidney injury. For NephMadness 2018, he chose virally infected kidneys as his champion.
But I think one area that I didn't really know much about that I really thought was very important was virally infected kidneys. And when I think about this, there are probably 5 reasons why this is very important. First of all, the patients who are awaiting kidney transplants have to wait 3 to 5 years. During that period of time, many of them end up with a significant morbidity and mortality. So waiting for a kidney is not good. We discard 500 Hep C kidneys every year, and so it's really a waste. And then also recently we found that antiviral agents are very effective in eradicating it. This is incredible to be able to eradicate hepatitis C, not only in patients without kidney disease, but patients with kidney disease. And now there's been a recent communication in the New England Journal of Medicine by Peter Reese, which shows that in 10 patients, they transplanted the kidneys from Hep C positive donors into Hep C negative recipients. And those patients then received antiviral therapy, and they eradicated hepatitis C in the recipient. And so now, rather than waiting 3 to 5 years, you only have to wait about 50 to 60 days, and you can get a kidney and eradicate hepatitis C in the donor kidney. I think this is remarkable, and I think it improves patient outcomes, symptoms. It's based upon incredible biology and therapeutics, which has, I think, transformed the way we treat these patients. But also, I think viral infected kidneys was on the top of my list because of the HIV story and how President Obama signed into law that you could transplant HIV-infected organs into HIV positive recipients. And this is being done now, and I think this is great. I think this is an opportunity to help individuals that would ordinarily not receive organs. So in the end, it was toad bladder and viral infected kidneys. And although I like history a lot, the new information and the new excitement is in viral infected kidneys, I think. And it takes advantage of outcomes. It takes advantage of new therapeutics based upon solid biology. So that's where I ended up.
Thanks so much to all the interviewees for taking the time to read this year's material and for explaining their picks. Also, thanks to all of you viewers out there watching. If you haven't done so already, please fill out your own bracket and read the scouting report for this year's NephMadness. The deadline to submit your own bracket is March 29th. Head over to ajkdblog.org to participate today.